Hey, Margie here. If you have knee pain or want to prevent knee pain, you must listen to this episode. You're going to learn number one, two fabulous exercises you can do every day to keep your knees healthy and lubricated. And this will make a big difference in the pain. Number two, why the x-rays don't always say everything. And, there's so much more than beyond the x-rays. And number three, what is a three-pillar approach to really reduce knee pain that may be stopping you from enjoying the life that you want to live? And I'm very excited about our special guest, Laurie Kertz Kelly. And Laurie is a physical therapist and co-founder of the Better Knees Method, a proven approach to helping active adults overcome knee pain without relying on medication, surgery, or injections. And since 2001, Laurie has specialized in providing solutions for people who've been told their knee pain is simply wear and tear or an inevitable part of aging. So there's so much hope. This is full of fabulous information as well as two wonderful exercises. So stay tuned. Welcome, Lori. I'm just so happy to have you here on the podcast. This topic is so important. So many people in our community, as well as just in general, listening, so many of the listeners are doing things and they have knee pain and they don't know what you're going to tell them. So I'm really excited. I'm always looking for physical therapists who've specialized in things and have really made a difference for people. And I just know what you're going to share is so important. So thank you so much for being here.
Margie, thanks for having me. I've been looking forward to this.
So, I always like the backstory before we even get started on all the details of, how did you even get into specializing in knee pain?
So, I was a new physical therapist and I was seeing this trend that unfortunately is still going on in healthcare today where people would have knee pain and they would seek out treatment and their knees would start to feel better. But that wasn't the end of the story. When their knees felt better, then they would go back to and resume the activities that they really enjoyed doing. But when they did, their knee pain came back. And they kind of felt stuck in this vicious cycle. And it was not possible to break that, to just go back to their activities and not have the knee pain return. So I was searching for answers. I met my now friend and colleague, Dr. Doug Kelsey, and together we created an approach that really focuses on where the knees are weak and where the knees are hurting so that that can be fixed and they can return to, my clients return to active lives and know what to do if they get, hints of a knee pain before their knee pain gets worse.
I love this because at the end of the day, that's what all of us want. We want strong bones, we want healthy knees so that we can live that active life, enjoy traveling, be with grandchildren, and just, there's such a difference when you can live that active life as you get older versus those who are limited by pain and issues. So this is just so wonderful. So, what happens is many people are told, this is the most common thing, that you know what? Your knee pain is just wear and tear and it's age related. And, I know that can be very misleading and you must hear that all the time, but there's really a better way to understand what's going on in the knee. And I know that's one of the key things that you talk to people about. Do you want to just share that with everybody?
Sure. Yeah. When someone's told that they have wear and tear in their knees, usually what's happened is they've noticed that they have some knee pain and maybe getting more severe or more frequent, or maybe they're just noticing like clicking or popping when they go up and down the stairs, or they have stiffness when they sit in a car or a plane for too long, right? They're noticing these symptoms and that causes them to go see their doctor. And their doctor, listens to their story and typically orders an x-ray. And that x-ray then is interpreted by a radiologist. So the radiologist, that physician is looking at the x-ray and saying, "Okay, is there damage here or is there not damage here?" And when there's damage, they rate it on a scale from 1 to 4. So 1 being very minor damage, very minor wear and tear, and 4 being severe wear and tear. maybe they give that person a grade 2. This scale is essentially the scale for arthritis or osteoarthritis. And that's oftentimes what people take away is like, "Oh, there's damage in my knees, so now I can't do anything about it." But that's where I think it's really important to recognize that there are many people running around, in some cases, quite literally running, and they don't have knee pain. But research has shown that if X-rays were taken of all of these people, many of them have damage in their knees, even though they don't have any knee symptoms. And so it's really important to know that a damage on an X-ray does not predict knee pain, nor does damage on an X-ray or wear and tear on an X-ray, nor does it predict whether you'll always have knee pain. It's possible to get out of pain even with an X-ray that doesn't look good.
I love that, and because that's so common that people are defined by their X-ray, "Up, you're bone on bone," without even and not all the people, there's many people I know, for example, my 85-year-old aunt has bone on bone, but yet the doctor, she's really active. They're like, "In no way, shape, or form are you a candidate," which I thought was really wonderful.
Good,
They
good.
looked at her, but oftentimes that's not the case, and, there's no other option, total knee, that's it. We'll talk about that later, but a lot of people hear the word arthritis, and they think, "Up, that's it, it's a downhill slide, and, that's the beginning of the end," but the truth is you can live and thrive with the diagnosis like that. So, what have you found, and what's your thoughts on that?
So I frequently explain to clients that arthritis means joint inflammation. So the first part of the word arthritis, arth means joint, which is where two bones come together. So the femur, the end of your thigh bone, where it contacts the top of your shin bone, the tibia, that's a joint, or where the kneecap is on the groove on the end of the thigh bone where it moves, that's a joint. The second part of the word arthritis, itis means inflammation. And I think there's typically a knee-jerk reaction that inflammation is a bad thing. And in many cases it is when it's the reaction of our body is over the top or it's continuous rather than temporary. But a small controlled amount of inflammation that occurs for a brief period of time can serve a really important role, a really important purpose. If, for example, you get cut on your arm and the skin is damaged essentially, right? Your body is going to it's wonderful. It will heal that, right? It will create inflammation. So warmth and swelling, redness, pain will temporarily happen. Those are signs of inflammation to heal the cut. And if the cut is minor, the new skin that's laid down, you can't tell that anything ever happened. If the cut is more extensive or more significant, if there's a rather large wound, then when the skin heals, you may be left with a scar. The scar shows that there was damage that happened there, but the scar isn't painful weeks or months later after the healing has happened. And the same thing can be true in our knees. We can get damage, but if the inflammation has been resolved, then we don't have the pain or the stiffness and the swelling.
That's so great, and it's a good analogy. So a lot of people when they think, "Okay, it's important to strengthen my knees," or "Let's work on my knees," but the only thing they think about is the leg muscles, that they're in isolation, the quadriceps and the different muscles around the knee. But that's so far from the truth, and I know your approach does much more than that and considers, the areas you have to strengthen as going beyond the knee. So you wanna just talk about that a little? Because I think that's so important, and I think, people look at the body in such isolation. "Okay, let me work on my knee. Let me do this exercise just for my knee." So I think this is an important concept that you really teach so beautifully.
So that's very true. Many people, once they're given a diagnosis of knee arthritis or they have knee pain, they're told by a physician or a physical therapist that they need to strengthen their muscles to take pressure off their knees, to keep their leg in good alignment. And sometimes that's the quadriceps or areas right around the knee. And sometimes that's the core and the glutes. And all of that is important. I never want to discourage or have people interpret that what I'm saying is strong muscles aren't important, because strong muscles lead to strong bones, and they prevent falls, and they do wonderful things for us in our life decade after decade. But what's often ignored are two structures that are inside the knees. And the first is the fluid inside our knees. When it's healthy, this is called synovial fluid. When it's healthy, the fluid inside our knees is thick and viscous, like egg whites. And when it's not as healthy, then it's thinner and watery. And healthy joint fluid, the purpose of it is to provide lubrication to allow our knees to move really easily, smoothly, without creaking or feeling stiff. And they provide some shock absorption because of that thickness and that viscosity. The second structure in the knee that's oftentimes ignored is the surfaces that are essentially the cartilage, the coating on the ends of the bones. There's this automatic understanding or assumption that cartilage, once it's damaged, is just it's down for the count. You're not going to ever do well again. And that's very far from the truth. So strong cartilage on a molecular level, right? They're cartilage cells and water molecules. And the tighter those chemical bonds are, the more firm the cartilage surfaces are in your knees. And if you have cartilage surfaces that are firm enough for your activities, whether those are sustained positions or dynamic movements, the pressure and the force that those place on the cartilage, when it's strong, can withstand it. And it's in the shadows. You don't think about your cartilage when it's working well. When it's weaker, those chemical bonds between cartilage cells, the building blocks of cartilage, and water molecules, the chemical bonds aren't as strong. And so the surface is softer. Some of your listeners may have heard of something called chondromalacia. That literally means cartilage that's soft or cartilage that's weak. And when it's weaker, our cartilage can't withstand the forces from activities. That might be a force like sitting in an airplane, or it might be a force like a challenging hike. But regardless, those forces put too much pressure on the cartilage, and the cartilage will begin to get damaged.
Hey, Margie here. High quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store. And in there, you'll see my favorite bone building supplements. So make sure to check it out. And the link will also be in the show notes. So let's get back to the show. Well, the good news that what I find is the best is that, as you said, people think, oh, my cartilage is damaged. That is it. People don't realize that there are things that can be done. And that's why I'm so excited about you and your approach. So you created the Better Knees method, and you have 3 pillars that you take people through that have really made a difference. And we'll share some of your results later. But you want to just explain what makes this approach from just, oh, let's strengthen your knee, or just, and again, we're both physical therapists, and I love physical therapy, but you've taken it even to another extreme to find what really is specific for knee pain. So you wanted to share what makes this different than just the basic, knee strengthening program.
Sure, sure. The first phase of the Better Knees method is soothing your knees. So if someone has stiffness, if someone, like in the morning when they wake up, for example, if someone has swelling, maybe their knee looks puffy, or maybe their knee just kind of feels tight and it's kind of hard to straighten or bend it as far as they used to be able to. or if someone has pain at rest. So they're just sitting on the couch. Maybe they've sat down after a long, busy day and they're not doing anything, but their knee is hurting. It's achy or it's sore. These are three milestones that we need to address in phase one, in the first pillar, which is soothing your knees. And we're going to target that joint fluid that I just talked about and really thickening the joint fluid so that it diminishes the swelling, the stiffness, and the resting pain.
Before we go on, I just wanna tell everyone at the end of this, 'cause we wanna do all the at the end of this video that Laurie really made 2 extra parts. She already recorded them that are so good, showing 2 different exercises that people can do, and that will help this phase, correct?
Absolutely. It
Yeah.
will. Yeah. Yeah. Then we'll move on to phase two. And phase two is strengthening inside the knees. And particularly because we already started working on thickening that joint fluid, now we're working on the surfaces and gradually applying the right amount of force, which is going to be different depending on what the strength that they start with is inside their knees, but gradually applying force to their cartilage, almost like it's a gentle massage that gradually firms up the cartilage. So this is a process that occurs over time. It's not like, oh, you just do one exercise for this many weeks or months and you're all good. You'll want to kind of gradually increase the challenge of this. But it starts out very, very easy. And what we're doing in this phase is addressing three more milestones. We want to get rid of pain when or stiffness or achiness when someone sits for a long period of time, or when they stand for a long period of time, like in the kitchen or at a concert or whatnot, as well as fitness walking. And fitness walking is different for different people. Some people, their fitness walk you know, is 20 minutes and somebody else is an hour and 20 minutes. But whatever the fitness walk, if that's limited, this is the phase in which that's going to start improving.
And before you go on to the next phase, just give me like one example of something that you would do in this. So the person's doing the 2 exercises initially to get the fluid going and to get movement in the joint. So what would be something that they would progress to in this phase?
It will depend on what that person's load tolerance is. So, load tolerance is the capacity of their knees to withstand force. Someone might be cycling in this phase, that type of movement, applying force and then going from a flat surface to a hillier surface or more challenging trail or something like that. But I often say, and I that cycling may not be above someone's load tolerance. So if you've tried cycling because that's kind of what people have said you should try. It may not work if your load tolerance isn't high enough, and in that case, we're gonna find other movements and exercises. So one of them is, and the exercise that I'll demonstrate a little later, but applying the force that's below their capacity. For somebody else, it might be doing some type of variation on a squat. So we make the squat easier. Maybe we use a chair and they only do the descent part of the squat. So they're doing what's called an eccentric chair squat, which means they stand in front of a chair and their heels are hip width apart and they're engaging their core and their glutes, and they, with control, it should take at least 3 seconds for them to sit down onto the chair. If that doesn't cause pain, then that might be appropriate, and they use their hands to stand back up again. That will apply a certain amount of force. Again, if it's above their load tolerance, then they're going to benefit from that and gradually make that exercise even harder.
I think this is so important because so often people will tell them, "Oh, that hurts, don't do it." But we know squatting, first of all, in terms of what it's shown in the research, in terms of, improving bone density in the Liftmore study and also affecting the area of the hip that's most prone to fracture, how important, and also functionally, just for our lives. So that advice to just stop is really doing people a disservice, where I love what you're doing. Let's break it apart. Let's gradually get up to there with these different activities. I think that's just so important. So how does a person who's listening, I know what you said with the chair, but is there, like, what would you tell someone to how to, who can't squat, let's say, how to figure out their load tolerance?
So one baseline to do at home is to stand in front of a chair, and given that your knees aren't painful when you're standing in front of the chair, can you sit down with control and stand back up with control? Meaning you're not dropping down, just plopping down onto the chair, but you're using your muscles. You're sitting down and you're standing up with good form, so there's equal weight on both your right and your left leg. Are you able to do that with good form 5 times and not have any pain? So not, "Oh, that hurts a little bit, but it's not really a big deal," but, like, no pain at all. And if you can, and again, when you stop, you also find that you're like, "Okay, I'm still good." Like, not it's not like you pay for it an hour later or the next day, right? If that's the case, then your load tolerance for your right knee and your left knee is about 50% of your body weight or more. If it's less than 50% of your body weight, then that's when we know we have to do some work to lead up to doing exercise that mimics or advances squats. And like you said, Margie, it's like if people are just told avoid squats, I think that's such a disservice because squats are more than an exercise that's done at the gym. That's an important part, and we know that, like, from the Liftmore study, it's like that's a piece of strong bones, but we also know that we have to squat to get up and down from the chair and a couch and a toilet, and we don't always have, like, places to put our hands to push up and protect our knees.
Yeah, so important. And, the good news is that, you've been doing this now for a long time and you've had such good success rates. You want to just share a story about someone, because a lot of people truly, I see this all the time. They only think, again, with the x-ray, their only option is surgery. And so you've had people really turn things around. So you want to, like, share a story so people can understand how this may be helpful.
Yeah, yeah. Oh, yes, absolutely. So there's 2 women that kinda come to mind. One, when I was working with her, I think she was in her late 50s. Her name is Rachel, and she had been running since she was in high school and college. And for about 10 years, she was having knee pain. And she had gel injections, she had cortisone injections, she had PRP, plasma rich platelet injections. She had surgery and where they trimmed off a meniscus. Then she had physical therapy and she graduated from physical therapy. She thought she was all good. 6 months later, she played tennis with her adult son and she got knee pain again. So she came to me and we worked together via online video. Um, and she actually lives closer to you, Margie, than she does to me. Um, but we worked together and she not only got rid of that knee pain, but then she was able to work, which she's a veterinarian. So she is down on the floor with animals and she stands for hours in surgery. And previously she wasn't working without knee pain. She is now able to work without knee pain. She loves to cook and she's cooking in her kitchen for hours. She does stand-up paddling, and, she plays pickleball, and she does yoga, so she's super active again and not having the knee pain.
So what was missing? What was it? Because she went to regular physical therapy. She had numerous she's had numerous interventions. What was it that you found that was missing from her program?
So, the missing link for her was she wasn't strengthening inside her knees. So her muscles were really strong. She had a strong core and strong glutes and strong quads and hamstrings and calves, but she wasn't using this inside out knee approach. by addressing what's inside the knee first, which is a lot more sensitive than say our muscles are, she was able to get the results. I often say, Margie, it's like if you're cooking and you go to the fridge and you get protein and vegetables out and you throw it together in a stir fry, it's hard to go wrong. Like it's probably going to turn out okay. And that's similar with muscles, is like we can work muscles pretty hard with a lot of different techniques. We can go to a gym and use a machine, or we can use dumbbells or kettlebells, or we can use body weight, to strengthen our muscles. And it will probably go okay as long as you give it a day or two in between to rest and recover. But when we're talking about the inside of our knees, it needs to be a lot more precise. So it's more like baking. It's like we have to use tablespoons and measuring cups, and we have to be a little bit more exact because the structures inside our knees are a lot pickier. They're pickier because they don't get the blood supply that muscles get, that bones get. So they don't get the same amount of blood supply, meaning they're not going to repair as efficiently. It's not that they don't repair, it's just that they repair at a different speed.
And you wanna talk about the second person?
Sure. Jan is a retired physical therapist, and she spent most of her career helping people. She was a home health therapist, and she saw many, many, many patients and helped them recover after knee replacement surgery. But when Jan started getting her own knee pain, she was diagnosed with a Baker's cyst, and then there was an issue with, first her medial meniscus and then her lateral meniscus, which is a type of cartilage in your knee. And she didn't want a surgical option. She was really clear. And Jan came to me because we have a mutual friend, also a physical therapist, who recommended me. And Jan was like, I just recorded a video with Jan. She's like, this was the piece that was missing. This was the missing link for my own knee recovery. And now she's doing great. She loves to dance, especially English country line dancing, and she's traveling around the world and just loving her life.
That's music to my ears because, so often we hear the diagnosis or we hear something and we just get shut down, and all our visions of enjoying a wonderful life that we want to are stopped. And so this is just so helpful. And so for people listening today, who are struggling, tell us, so you have 2 great exercises that you did in detail that are gonna be at the end of this video, but just tell us what the most powerful steps that they can, and then they'll learn about the exact exercises afterwards.
Yes. So the 2 steps that I would recommend are going to address those 2 structures inside the knee that are oftentimes ignored. So the way to address the health and the viscosity, the thickness of the joint fluid is by using the muscles on the front of your thighs in a way that the knee doesn't move. The knee doesn't bend or straighten. So this is known as isometric exercise. And there's great research to support the increase in viscosity when these exercises are done on a consistent basis.
And how often, I know you go into this in the video, but how often, this is key. It's not like you can do 2 in the morning and be done for the day. It's very easy exercise, but tell us how often that you found it's necessary to really see a difference.
It's a very simple exercise. I liken it to, because sometimes people get a little, I think, apprehensive, like, "Am I gonna have to do this for the rest of my life?" Not necessarily, but when to start, especially if your knees are a little vulnerable or you've had some pain or something, a set of 10 may take 2 minutes, which is about the same time that it takes to brush our teeth. So it's kind of like just some maintenance duration, and it doesn't make you sweat, and it can kind of be woven into, a normal day. So I would say if someone is starting off and they wanna really, get rid of some symptoms that they're having, they're not necessarily preventative, but trying to actually remedy some knee pain or stiffness, try 3 times a day, and maybe it's as short as 2 minutes each. But it really that has been again over and over. It's supported, and my clients, I see it, they're always surprised that something so simple can have a profound impact.
You know, it's so interesting to me because they're called quad sets, and there's something we learn in physical therapy school. And I used to work in acute orthopedics, and right after surgery, of people doing it. But it's just not taught this way. Like we need to lubricate the joint before you do other things so that you can do other things. Am I right about that? It's
Abs Yes, yes, for sure, because if it's such an easy exercise, and people that are not, are not sedentary, right? Active people are, if they're not taught why they're doing it, they're gonna think, "This is silly. Why would I waste my time doing this?" But if you know why you're doing it and the impact that it has, and you have someone measuring the progression and the advancement, that you're making in your joint fluid, then it's like, "Oh, it's a great payoff."
it's just as a physical therapist, I'm thinking, "Why is this not in every program before someone's going to the gym? Do some quad sets, get the joint lubricated," so it like, once
Yeah,
you
yeah.
think that it's sort of backwards, so I love that, and that at the end of this video, there you Lori does such a good job of showing exactly how to do this. So talk about number 2.
So the second piece is you wanna move that fluid around and begin to massage your cartilage, begin to create gentle force on the cartilage that encourages those chemical bonds between water and cartilage cells to encourage it to get kind of firm up. And so I've walk you through a very easy, simple movement to do at home. This is going to be safe for the vast majority of people, even if, say, cycling kind of hurts your knees or makes your knees sore, or even if you're not really sure, this is going to be a gentle but very effective movement to both spread around the fluid and to prevent those cartilage layers from kind of sticking together or gelling together when you are sitting, say, it for a long period of time.
Ah, yeah, so they're at the end of the video in detail, so you'll be able to see that. So something else I wanna ask is because there is a time and a place for surgery and for some of the other things that the orthopedists do, who, once, there are people who've had knee replacements and now they're be able to go back to their activity. So at what point, what criteria do you use when someone goes to the doctor and they say, "Okay, that's it," in terms of first working with you or first, what do you tell people? Like, who would you say, "Oh, you know, you really do need a knee replacement," or is there a certain criteria that you use, or what do you tell people?
When I'm speaking with someone who's interested in this approach, for example, I'm listening to their story and listening to when they get knee symptoms, what causes their knee symptoms, and what makes their knee symptoms better, even if that's maybe avoiding certain activities. And what I'm looking for is, do their knees respond by do they get increased symptoms when there's more force on their knees, whether that's force from stairs or squats or some type of, sport like pickleball or golf, or whether it's from the knees just remaining in a position for a sustained period of time, like standing or sitting or sleeping. If that's the case, and by performing some amount of movement, or you know by taking that force off of the sustained position, then that tells me, this kind of tells me that, okay, they are load it's their knees are affected by load. Too much load, too much force causes the symptoms, causes the damage of the cartilage, which then inflames the joint lining, which has the nerve supply that tells the brain there's a problem down here, achy, stiff, sensations start to arise. If they take those forces off, then they don't get that same cascade of force on their cartilage, microscopic damage, and eventually irritation to the joint lining and symptoms. That means that they're going to respond. Like, all of our tissues in our bodies are, our bones and our muscles and so forth, they all can get stronger or they all can get weaker. And so knowing that that's the case versus someone comes in and they, or contacts me and they have maybe an autoimmune situation going on or like a rheumatoid factor or that type of thing, and they have systemic inflammation that's not related to how much force goes through their knees. That's someone that I don't think is probably going to respond positively to the better knees method or to inside out knee health. But in terms of like whether or not you can avoid a knee replacement, that is less to do, somebody can send me their images and their images won't predict that. I work with people initially, usually in a 3-month period of time, and I expect change to happen then. If it happens then, it's likely gonna continue. There may be a ceiling for some people, but if that improvement is at or above the level of activity that they desire, just like your aunt, if she's able to be active and not have the symptoms, the X-rays don't have a role in telling them that they need a knee replacement.
Yeah, it's so interesting and so annoying to me. My husband, who had AC, he injured his knee playing football, as in high school a long time ago. And the doctors down the road are like, "Up, you're going to need a knee replacement by the age of whatever." And here he's 68 and he's doing great, and staying active and biking and doing everything. And so I hate when they say that because that doesn't have to be the case. And yes, when it is the case, great, but I think that's also another point for people, and tell me your thought on this. Sometimes, okay, so let's say someone says, "Okay, I'm gonna have the gel or I'm gonna have, the injections." Should they see a physical therapist afterwards? Is it okay to just get that without any instruction? What's your thought on that?
Oftentimes, people are kind of just given a gel injection, and they're just kind of they're just left to their own devices, you
Yes,
know?
all the time. So what do you think about that?
Well, I have very specific recommendations that I provide clients, and I also have a guide for people to make the most of hyaluronic acid or gel injections, and I'm happy to share that with
Oh,
listeners, Margie.
great. This is so wonderful, and I love, love, love the fact that you work virtually with everywhere in the country or y you
I work with people around the world, so I have clients in Australia and Finland and the UK, Canada, the US, South
That
America.
that's fantastic, and, I think this happened I don't know when you started working with people all over, but from so many physical therapists, really all over, they said to me they never thought because PTs, we learn to touch people and work, and people had said to me, when COVID happened, "Oh gosh, what are we gonna do? We're never gonna make change in people." But just the opposite happened. It opened up that, wow, we can do so much even when we're not there one-on-one. Is that what I don't know when you started doing is seeing people all over the place, but
Yeah, I've been doing this over 10 years. So I started well before COVID, and that was kind of a concern for people initially, right? But it isn't as much anymore. Really, the value I find in working with clients is, eliminating the guesswork so that they're not just wondering, like, am I doing too much of this? Am I not doing enough of it? Am I even doing the right things? So eliminating the guesswork and having a really clear, customized path forward is what I can provide, and I don't have to, yeah, I don't have to be there in person, touching their knees because they're doing the work for their knees and they're improving them.
so exciting, and so when I first introduced to Lori, I'm thinking, "Oh my goodness, this is your work is so needed with all the people that I work with in my membership and all the people who are working so hard on strengthening their bones, but yet they have knee pain." So I immediately wrote to Lori, I said, "Besides coming on the podcast, would you be interested in doing or would you think it'd be effective to do a class a month like I have monthly classes and we to be the guest expert and really teach people besides the two exercises what they can do and so Lori said yes. So that's going to be for those people who are listening in real time. It's November 6th at 12 o'clock noon Eastern time. I'll have that. The link is going to be tinyurl.com/. strong bones and healthy knees. But I'll have that in the show notes. So Lori's going to be doing that. And I always keep the price super low. It's just $22. But so I'm really excited about that class. And if you're listening to this after the fact, you can purchase the replay. So everything, everyone always gets a replay that they can keep and have all this. So I'm really excited about that. That'll be in the show. Tell everybody also though, how they can get in touch with you. And if they do, I just think it's wonderful that, you work with people all over the place because that's always a problem. All right, this sounds great, but there's nobody here who does this. How do I find a PT? So why don't you just share how people get in touch with you?
Sure. I have a guide that people can download that takes them through 3 steps to start building better knees at home. And they can find that at enjoystrongerknees.com. And my website is betterknees.com.
Okay, yay. This is just so important because, we all are doing strength training and we know strength training is so important. It's just one of the pillars of everything that I teach and I've seen bone density skyrocket. It's amazing. Plus I do this myself. And when knee pain precludes you from that, plus your life, it's unfortunate. And yes, if you need surgeries, I'm certainly a big believer in that. But if we can do other things, I love the nourishing your knee from the inside out, what you teach, and it makes so much sense and it's easy to do. So I can't wait for everybody. So is there anything else? Well, I'm going to show the videos unless is there anything else you want to say? Because we're going to show the videos now and then we'll come back. Is there anything else you want to say before they see these 2 videos?
Margie, I just want your listeners to experience some hope that if they're having some knee pain, that it's not a permanent situation. It's likely, if it's arthritis, it's related to inflammation. You get rid of the inflammation, you get rid of the pain and the problems.
Yes, and that's hope is what's so important, and hope's oftentimes taken away, I mean, the good thing is it's not taken away because there are surgeries, and we're not against surgeries, but there's so much more that can be done to really live a healthy, vibrant life. Okay, so I'm gonna play the 2 videos, and then we'll come back.
To improve the fluid inside your knees, start with your legs supported out in front of you. So you'll be sitting on your couch or the bed. If you find yourself on the floor, that's fine as well, but you want your legs supported straight out in front of you. Then take a bath towel, fold it in half lengthwise, and roll it up. You can also use a pillow that's been tossed on the couch or a pillow off of your bed, but place it underneath your knees. Sometimes 2 bath towels rolled up together is more comfortable than 1 for people. You want your knees to feel comfortable, relaxed, supported, not just in this starting position, but throughout the entire exercise. So make sure to make that happen. To begin, you're going to engage your core, and the way I'd like you to do that is envision that you have a candle held at arm's length. You're going to blow out the candle through pursed lips, so a sharp exhale will engage muscles on the front of your abdomen. You can also envision inflating a balloon. It'll have that same effect. You're going to want to hold on to that core contraction, the core muscle contraction, and then you're going to squeeze your glutes together. So tighten your glutes together. Now your core is engaged, your glutes are engaged, and finally you'll turn on or activate, contract the muscles on the front of your thighs, your quadricep muscles. And in doing so, you'll feel the back of your knees press into the towel roll. The intensity doesn't have to be enormous. So a gentle amount of force to engage these muscles is plenty. You want your knees to feel good and neutral throughout the entire exercise. You're going to hold all 3 of these contractions together for 5 seconds and then relax. Now you're welcome to stay seated upright like this. You're also welcome to lie down completely flat or to have something kind of halfway in between, like a reclined position. So let's do that again. Core, glutes, tightening the rear end together, and then your thigh muscles engaging, holding for 5, 4, 3, 2, 1, and relax. Notice my ankles, my back of my heels, my feet, they are staying supported on the surface that I'm lying on. So this is not an exercise where I'm trying to straighten my knees or kick my feet up. So again, core, glutes, thighs, holding for 5, 4, 3, 2, 1, and then relaxing everything. Given that this feels good, I recommend that you start by performing it 5 or 10 times in a row, maybe 20 times if it feels really good, and then repeating this 3 times throughout the day. Engaging your core first, then your glutes, then your thigh muscles, and holding for 5, 4, 3, 2, 1, and relaxing. To spread the fluid inside your knees, to spread it around, and to massage the surfaces deep inside your knees, which will decrease or prevent stiff, sore, and achy knees, you'll want to start by sitting in a chair. I'm using a furniture slider. You'll need something to decrease the friction between your feet on the ground and the surface that you're sitting on. So I'm sitting on a hard surface, and this is a furniture mover, a furniture slider that is meant for hard surfaces. There are also furniture sliders meant for carpeted surfaces. If you're sitting on a surface that's hard and you don't have a furniture slider, a furniture mover, you also can use something like a dust cloth. On carpet, you might be able to use a paper plate. Whatever it is, you're going to place it on the floor, and then you're going to put your foot on top of it, in this case, on top of the furniture slider. You want the friction to be really low. You want it to be really easy to slide your foot in and out in a comfortable range of motion. This is going to prevent the surfaces inside your knees. If the surfaces aren't as strong and healthy as they need to be, it's going to prevent those surfaces from sticking together or gelling together. In the case of arthritis, oftentimes, the longer you stay in a position, the more those surfaces tend to stick to one another. And then when you get up from sitting, for example, they can kind of feel uncomfortable. It takes a few steps to kind of get going again. The exercise is sliding your foot in and out in a comfortable range of motion for your knee. So your knee feels good or neutral the whole time. You're not expecting to get tired. Your muscles aren't going to, once your muscles start to get tired, if you're doing that long enough, then it's time to stop. If you feel anything uncomfortable, so maybe there's a click or some type of discomfort, I recommend a couple of things. One, start by, before you begin the movement, engage your core. Forcefully exhale through pursed lips. Maintain the tension you feel in your abdomen. Then squeeze your glute muscles together. So you're squeezing your rear end together. Your core and your glutes are now engaged. Then add the movement with your foot. And oftentimes that will decrease or eliminate that clicking, which is a form of friction inside your knees. If we can avoid it, that's ideal. You can perform this exercise, the sitting sliders exercise, for several minutes and repeat it a few times during the day. Or it might be something that you do several repetitions. So you slide your foot in and out several times in a row every hour or so. This keeps your knees lubricated and feeling good.
Wow, Laurie, you just did such a great job recording those exercises, and I know they're going to help people. So I can't wait to hear from everybody. When you do them, please share what your results are, and I will share them with Laurie. And it's just, that's why I love doing the podcast. I have to be honest. When something as simple as that could change someone's life and change their pain, which it can, and then you hear about it and you realize, just because I found you and you came on the podcast, lives were changed. And that just makes me so happy. So thank you so much for being here. I'm so glad I discovered the work that you do. And I'm just excited to stay in touch, and the class you're going to do, and just all the people that you're going to help or you continue to help. So thanks so much for joining me here today. It's really been a pleasure.
Margie, thank you so much. And I appreciate the work that you're doing. Strong bones are so critical for our long, healthy lives and staying confident into our age.
Thanks so much. I hope you enjoyed my interview with Laurie as much as I did and have a better understanding of what's actually going on in your knees and what you can do to really make a big difference and reduce knee pain. Definitely try out the 2 exercises that she showed us. And if you want to learn more, please join us for our class because she's going to show more exercises and be available also to answer questions. So to do that, just go to tinyurl.com/strong bones and healthy knees. And all the links will be in the show notes. And, if there's anybody that you know who could benefit, please share this episode with them. And thank you so much for tuning in. And I look forward to seeing you on the next episode.